I was first aware something wasn't right with Cooper when in the morning he woke up with a small pain in his leg. But he's a fairly busy young man, and I didn't think anything of it and sent him to school, as you do as a mother. Then received a phone call later that afternoon from the school to say that he had been in sick bay for about 30 odd minutes. He wasn't getting any better to come and get him. So I went and picked him up from the school. Didn't think anything of it. Didn't rush there. They didn't give me any reason to rush there, so took my time, and but then noticed that he wasn't very well when he walked out of the sick bay. He was still complaining of that pain in the right groin area, and took him home. When we arrived at the hospital the first time, we went to the nurse's station and he was assessed by the nurse there. Then we had to go and wait in the waiting room. We did wait for a fair amount of time. Cooper's symptoms had settled down slightly. He just wanted to sleep, so I took him over to the chairs and he sort of fell asleep on the chairs. We were waiting for some time, and I ended up going back to the nurse's station and just asking, how long we had to wait, or what order we were in, what priority we were, and she came over and she had a quick look at Cooper, and she mentioned that there was a fairly long wait, that there was a gastroenteritis bug going around. There was probably better off to take him back home where he'd be more comfortable, just keep the pain relief up to him, keep the fluids up to him, and if anything, if he deteriorated, to come back in. So I did that, just thinking that, okay, it was a gastro bug, and that's maybe where the pain was coming from. So I popped him back in the car and I took him home. For me to think there wasn't something right, there were a few flags that as a mother, you see in a child, when they just got a flu or a bug or a gastro bug or something. But everything we were doing, giving Cooper the pain relief, rubbing his leg, putting ice packs on it, they just weren't relieving anything. His temperature was still rising. It had hit 40.6 on our thermometer, and there was nothing that we could possibly do. And I said to my husband, this is something not right. This is not a gastroenteritis bug or a flu or a cold. I don't know. I think from a mother's perspective, I just knew, gut instinct, that it wasn't something that we could treat at home. So the main trigger for me was his temperature wasn't coming down with any pain relief, and he was just very ill. The second time we needed to get Cooper to the hospital was his temperature was 40.6, and everything we were doing at home wasn't helping him. We needed to get him to medical aid pretty quickly. My husband went to ring GP Access, but by that time I'd sort of had him in the car, and I said, no, I'll meet you up at the hospital, we need to go. It was nothing we were doing at home. We couldn't bring his fever down. We couldn't relieve the pain. He was changing colour. He was just a very sick young man. Yeah. On the way in the car, within about 6-7 minutes of driving, we didn't live very far from the hospital. We're only about 10 minutes away. I kept sort of watching Cooper at my peripheral vision, and he ended up having a fit. He was convulsing. He was sort of regurgitating matter. So I actually pulled over off the road, and so I thought I couldn't do anything for him anymore in the car. I needed to get to hospital, which was just around the corner. So I did. I cleared his airway out. I sort of propped him back a little bit and held him with one hand and drove the car to the ambulance bay, or to the hospital, which was just around the corner. He was still breathing at that time, but he just wasn't with us. He was really quite unresponsive at that time. Very, very hot. I remember touching him and he was just hot. I drove around the corner, it was only just around the corner, and drove into the bus stop over the hospital. And at that time, Cooper did wake up and said to me, you know, Mummy, am I dying? And I said, no, buddy, you're all right. We'll get you there. And I flew out of the car, went around. He's quite a large boy, and he was just, very unresponsive, very lethargic, quite hard to manoeuvre. I noticed that the security staff were coming out. I don't know if I was going to get in trouble or not, but they came out to assist. So one of the security guards actually got Cooper out for me and carried him, and then the security guard had got a wheelchair and put him in that. And they took him straight through to emergency while I just locked the car up and got my handbag. And the doctor just started hammering me with questions, you know, had he been bitten by a snake? Do you believe I was a spider? Was there any poisons that were evident around the patient? He just had to go through that process of elimination. He ended up with about 10 or 12 nurses around him at that time, and then I had one or two with me. I don't know, I must have looked like I was in shock or something. And then they sat down and the doctor said, all right, well, we have to do this, otherwise he's not going to get through it. And they had to ask permission, you know, to give him this. They said I think it was a broad rage antibiotic because they didn't know what was attacking him. He did have the little black dots come out on his leg, and the nurse and I think her jaw dropped as well when we saw that. She hadn't seen anything like that as well. And about 2 and a bit weeks, he was in hospital. He had test after test and blood test after blood test and MRIs, and he was in there for around 2 and a bit weeks. I don't remember the exact time we were told what had happened to Cooper. I think it was around 2 to 3 days we were told that Cooper had sepsis. No, I don't believe he recalls a lot of what happened. He has snippets of what happened to him. He doesn't remember the lead up to it. He remembers waking up or being brought out of the coma. He doesn't remember a lot of the tests. He doesn't remember when he was in intensive care. He doesn't have a lot of recollection of that time. He only sort of mentioned to Greg and I that he had recollection towards the end of the 2 weeks of not a lot, unfortunately, or fortunately. There's no one to blame in all of this. I mean, I could go back and blame myself for sending him to school in the first place in the morning. You know, we just didn't see the signs or the symptoms. To tell you the truth, it was quite surreal. You don't believe that it's happening to your child. It's not something that I would have expected, that I'd sent my son to school and then give it 12, 13 hours later he was fighting for life. I didn't expect that to happen. So it all happened very quickly. It didn't really hit us until months. I think it took 6-7 months before it actually came to the realisation that we could have lost Cooper. It was noted that he was very, very sick, and we were told his chances of survival. But I think we just went through the motions. You're numb for a little while. You're numb for quite a substantial amount of time, and then I think it's when Cooper, it took him 6 to 7 months to recover fully. Well, I believe it did. Probably longer for him because he wasn't able to ride his bike or weight bear as much as what he would have liked to have. Very traumatic when you look back on it, yes, very, very traumatic. But I think we just went through the motions, and when he finally was admitted, they saved his life, you know. I mean, they did all the right things, so the team couldn't have done any better. But I think it was time. Time was a big factor with us, that if we left it for another hour or 2 hours, I don't know if Cooper would be sitting here with us now. I think that was the big thing for us. It was the time factor. If we had left it any longer to get him into hospital the second time, I don't know if we'd be sitting here now with him. So
it took about 8 months of being treated for sepsis for Cooper to return to normal activities. We're pleased to say that Cooper can now ride his bike again and is very happy to be back playing his beloved soccer. Simone has shared this story with the aim of raising awareness about sepsis and the need to seek timely diagnosis and treatment. Sepsis is a medical emergency. The Clinical Excellence Commission thanks Simone and Cooper for sharing their patient and family experience.